So welcome to the lecture series. Today we are going to look at factors affecting fixation or quality of tissue fixation. One, we have temperature. Number two, we have tissue size. Number three, volume ratio. Number four, pH. Number five, penetration of fixative. Number six, tissue storage. Number seven, fixative osmolarity. Number 8, fixative ionic composition. Number 9, concentration of the fixative. Number 10, we have additives. So starting with the temperature. How does temperature affect fixation or quality of tissue fixation? Temperature in tissue fixation is the controlled thermal environment. This controlled thermal environment can either affect penetration rate of the fixative, reaction speed of the fixative, and overall quality of fixation, leading to either enhanced preservation or tissue damage. For purposes of understanding better, we can categorize temperature into three. One, we have low temperatures between 0 to 4 degrees centigrade. So low temperatures slows down the penetration and reaction of fixatives. In so doing, this minimizes autolysis and putrefaction in fresh tissues. So autolysis is caused by the action of endogenous enzymes within cells. So within the cells, we have the lysosomal enzymes, which break down cellular components after death. So at low temperatures, the enzymatic reaction slows significantly because enzymes require specific temperature ranges for optimal activity. And the cold conditions inhibit the movement of enzyme molecules and reduce reaction rates, preventing rapid self-digestion of the tissue. Then in regard to putrefaction, putrefaction is the decomposition of tissues by bacteria and fungi, which thrive at warmer temperatures. So low temperatures inhibit the metabolism and the reproduction of microorganisms, effectively slowing or halting their growth. So this reduces the production of harmful byproducts, for example, gases and acids that can damage the tissue. So by reducing the activity of enzymes and microorganisms, low temperatures act as a protective measure against tissue degradation, ensuring better preservation before and during fixation. The second category is room temperature. So room temperature is the standard temperature for most routine fixation procedures, mostly when you're using formalin as our fixative. So this balances penetration speed and tissue preservation. The third category is high temperatures, 37 degrees centigrade or higher. And this is the focus of our discussion in regard to temperature. So higher temperatures increases diffusion of molecules, which accelerates fixation by promoting faster cross-linking of proteins and preserving tissue morphology. So higher temperatures also reduce the viscosity of fixative solutions, allowing them to penetrate tissues more efficiently. So in fixation, different fixatives fix differently, or they have different modes of action. So in this case, for formalin, which falls under aldehydes, aldehydes fix tissue by cross-linking. So protein cross-linking is the chemical reaction during tissue fixation where fixatives such as formaldehyde or glutaraldehyde create covalent bonds between amino groups of proteins. So when these covalent bonds have been formed, stabilizing the tissue's structural and molecular integrity. So this process, or the process of cross-linking, stabilizes the tissue structure by linking proteins together, preventing degradation, autolysis, and loss of cellular architecture. So formaldehyde reacts with amino groups of proteins, forming methylene bridges between protein molecules. So why is protein cross-linking important in tissue fixation? One, preservation. So protein cross-linking locks proteins in place, maintaining the structure of cells and tissues. Number two, stability. It makes the tissues resistant to mechanical and enzymatic degradation. Number three, compatibility. It prepares tissues for staining and microscopic analysis by preserving antigenicity. So it's very important to note that in routine fixation, most tissues are fixed at room temperature for convenience and to maintain balance between reaction rate and tissue preservation. However, the heat-sensitive tissues at low temperatures are used for tissues with fragile structures or heat-sensitive components. Thirdly, we can have rapid fixation, whereby high temperatures or microwave fixation are employed when rapid processing is needed, such as in intraoperative pathology. However, excessive high temperatures may lead to overfixation, causing artifacts of tissue size. Tissue size significantly affects the efficiency and quality of fixation because it determines how well and how quickly the fixative can penetrate the tissue. So fixatives penetrate tissue at a limited rate, often estimated at 1 to 2 millimeters per hour, mostly for formaldehyde. Therefore, large tissues require more time for complete penetration, increasing the risk of autolysis and putrefaction. Therefore, specimens like segments of colon or small intestines should be surgically opened to expose all tissue layers before placed in the fixative. Additionally, solid organs like the breast, spleen, and kidney, they require to be bread-loafed or sliced into smaller pieces to allow faster penetration of the fixative. Volume ratio. So in fixation, it's very important to compare the volume of the fixative and the much of the tissue we have. So the fixative volume should be greater than the tissue volume for two reasons. Fixative molecules are bound chemically to tissue, and thus the solution is gradually depleted of these molecules. Secondly, tissues also contain soluble salts that are dissolved by fixative solution. So the two-way exchange does not greatly alter the characteristics of the fixative if a large volume ratio is used. However, if the volume of the tissue is greater than that of the solution, the fixative composition can be altered, leading to poor fixation. That's why it's very important that the volume of the fixative is 15 to 20 times greater than the volume of the tissue. Time. Ideally, tissue should be placed in a fixative immediately after surgical removal, and autopsy should be performed immediately after death. So the more time that elapses between interruption of blood supply and fixation, the more postmortem changes occur. Tissue that is not well fixed is not processed well and subsequently will not stain well. Therefore, adequate fixation time is of primary importance in quality assurance. Additionally, tissues can be fixed for approximately 6 to 8 hours in formalin solution. pH. pH is a measure of acidity or alkalinity of a solution. In regard to a pH scale, it ranges from 0 to 14. pH less than 7 is regarded as acidic pH. In other words, we have higher concentration of hydrogen ions. pH equal to 7, that is neutral pH. We have equal concentration of hydrogen ions and hydroxide ions, for example, pure water. Whereas pH above 7 or greater than 7 is regarded as alkaline pH. In that, we have lower concentration of hydrogen ions. So pH affects the chemical reactions involved in preserving the tissue and maintaining its structure. For example, protein cross-linking. Most fixatives work by cross-linking proteins, for example, formaldehyde, and these reactions are pH dependent. At neutral to slightly acidic pH, that is 6 to 6.8 to 7.4, this pH is efficient for protein cross-linking while minimizing artifacts. Whereas highly acidic pH, which is appropriate for Bowen solution, pH between 3 to 4, that pH is appropriate for preserving glycogen and connective tissue. Alkaline pH. Alkaline conditions can enhance protein solubility, which may reduce fixation efficiency or create artifacts in some tissues. The other example is nucleic acids. pH influences the preservation of nucleic acids, mostly DNA and RNA. Acidic conditions can cause hydrolysis of nucleic acids, leading to their degradation. Neutral to slightly alkaline pH is better for preserving nucleic acid integrity during fixation. The third example is preservation of cellular organelles. At acidic pH, most components such as lysosomes and mitochondria are fixed well, whereas at neutral pH fixes general tissues to maintain structural integrity across various cellular components. At neutral pH, which is preferred for general tissue fixation to maintain structural integrity across various tissue components. Therefore, most fixatives are buffered to maintain a stable pH during fixation and ensuring consistent results while minimizing tissue damage by adding a buffering agent. So these buffers helped prevent fluctuations or change in pH that would interfere with the chemical reactions between the fixative and the tissue, hence ensuring effective fixation and preserving the tissue morphology. There are common buffers that are used, for example, phosphate buffer with pH between 7.2 to 7.4, commonly used in formalin. Hence, we usually have neutral buffered formalin, the commonly used fixative in histology. This prevents the formation of acidic formalin, which can damage tissues. We have a cacodylate buffer at pH approximately 7.2, which is commonly used with glutaraldehyde for electron microscopy to preserve fine ultrastructural details. Thirdly, we have Tris buffer at pH 7.4 to 8.0 that is occasionally used in fixatives for specific application requiring slightly alkaline condition. Penetration. Fixative solutions penetrate at massively different rates. For example, research has shown that formaldehyde penetrates faster than any other fixative. So we need a fixative that can penetrate faster in order to arrest autolysis and putrefaction. Tissue storage. So after the ideal tests have been done, it's also important to note that these tissues can be stored for some good time. And in case any other test is requested, that tissue should be able to provide appropriate results. So in case of additional studies, it's very important that tissue is stored in a fixative that will maintain its integrity. Neutral buffered formalin has been seen as the best solution for tissue storage for a very long period of time, which is not true with many other fixatives. Fixative osmolarity. Osmolarity refers to the concentration of solids in the fixative solution, which affects tissue hydration and morphology. So how does fixative osmolarity affect quality of tissue fixation? Under this, we can still categorize osmolarity of fixative into three. One, we have hypertonic fixatives, in which we have higher solute concentration than the tissue's intracellular fluid. Therefore, water moves out of the cells into the fixative by osmosis, and this leads to cell shrinkage. This is common with carbonized solution. Isotonic fixative. In isotonic fixative, we are having solid concentration equal to the tissue's intracellular fluid. Therefore, no net movement of water occurs, hence maintaining normal cell size and morphology, and tissue is preserved in a more natural state. The classical example is phosphate buffered formalin, a widely used isotonic fixative. Thirdly, we have hypotonic fixative. In hypotonic fixative, we are having lower solid concentration than the tissue's intracellular fluid. Hence, water moves into the cells from the fixative, causing cell swelling, rupturing the cell membranes and distorting tissue structure. Classical example is use of diluted formalin or saline solution. So fixative should ideally be isotonic to prevent distortion of cellular structures, whereas other literatures prefer a slightly hypertonic solution. Ionic composition. It's very important to understand the ionic composition of the fixative, since some ions like sodium, potassium, calcium, and magnesium can affect cell shape and structure regardless of the osmotic effect. However, the ionic composition of fluid should be as isotonic as possible to the tissue. Fixative concentration. So concentration of the fixative affects the rate and extent of fixation. Usually low concentration may result in incomplete fixation or autolysis. Higher concentration can cause overfixation, protein coagulation, or shrinkage. For instance, glutaraldehyde is typically used at 2.5%, while higher concentration can harden tissues. So optimal concentration varies by fixative and tissue type to balance penetration and preservation. Let's go to electrolyte additives. For example, we have calcium chloride. Calcium chloride stabilizes cell membrane by interacting with negatively charged phospholipids. It also reduces cell shrinkage or swelling by balancing ionic composition. It's very important in preserving ultrastructure in electron microscopy. Another one is potassium thiocyanate. This increases tissue penetration and softens connective tissues. So it helps maintain intracellular proteins in their native conformation. We have ammonium sulfate, which precipitates proteins by altering solubility, aiding in structural preservation. It also maintains ionic strength, ensuring better tissue morphology. The other electrolyte is potassium dihydrogen phosphate, which acts as a buffering agent to maintain the pH of the fixative, and it preserves enzymatic activity and protein structure by stabilizing ionic conditions. Then the non-electrolytes, an example is sucrose, which serves as an osmotic stabilizer, preventing tissue shrinkage or swelling. It also protects cell membranes and organelles during fixation. The other example of non-electrolyte is dextran. So dextran maintains osmolarity and hydration of tissues. It also helps prevent collapse of fine structures like microvilli and organelles. Stabilizes proteins and intracellular compartments by reducing mechanical stress. So it's very important that these additives are used efficiently. Why? Prevention of artifacts. So they avoid tissue distortion due to osmotic imbalance during fixation. Improved ultrastructural preservation. So they stabilize membranes, organelles, and cytoskeletal elements. Number 3, enhanced protein stabilization. These additives preserves the native structure of proteins and prevents denaturation. And lastly, the buffering effect. They maintain pH stability, which is critical for enzymatic activity and tissue morphology. Lastly is additives. Additives, these are substances that can be added into the fixative purposely to improve the morphology of the fixed tissue by influencing the osmolarity, ionic balance, and physical properties of the fixative solution. These additives help preserve tissue structure and prevent artifacts during fixation. So these additives can either be, commonly they are either electrolytes or non-electrolytes additives.